Need to slow down to allow our body kind of recover. You've got to be more in tune with your body. You've got to listen to your body so you know what it's telling you. Hey, it's Dr. Lin with Empower Physical Therapy, and today I want to talk to you about another principle that we've educated our current patients about as they embark on a healing journey. And that principle is to slow down, to speed up later. Most of us operate at a breakneck speed. Amazon has conditioned us in such a way that we expect things within the next 3 hours, the next day, the next 2 days. The culture of instant gratification in our daily lives has now been applied to our healing process. That if I get hurt today, this pain that came on, I expect it to heal yesterday. Get me out of this. I get it. The level of patience that we have has gone down, and the level of instant gratification has gone up here, where if I order something from Amazon and 2 days ago, and it should have been here and it's not, I'm going to be pissed. Yeah, I'm going to get, and I no longer want that item. That's the mindset and the behavior that Amazon has conditioned us to expect of things, and that we've expected of certain things of our health as well. We've applied a similar instant gratification to our health. But over the years of working with patients, healing is time. Healing has its own timeline that we need to slow down to allow our body kind of recover. You've got to be more in tune with your body. You've got to listen to your body so you know what it's telling you. That's why it's so important that you slow down now during this rehab process, so that you can be more in tune with what your body is trying to tell you and make those changes. And then once you've kind of done that, then you can speed up later. Most of us don't have that level of patience when it comes to recovering from an injury or something that you've been dealing with this for a very long period of time, especially if you've got chronic pain, that you've been living with knee pain, back pain, shoulder and neck pain for years. You just don't have that patience. You snap at people and your friends and family members a lot quicker because of that buildup of pain that you've had in your system, because of the injury that you've had in your system. That you don't want to do the things you used to be able to do, that you expect things right then and there, that we don't have patience for this healing process. I've had the pleasure of working with a lady, a mother of 3 kids, who was involved in a car accident, and that her husband was on disability. And as a mother, they'll do what it takes to get to where they need to be. So her initial fear was to get in the car and drive again after that car accident, which is the first fear that most people have who've gone through a car accident, is the movie of that accident will get replayed in your head instantly, gets replayed over and over again. And that fear blows up. You don't want, you can't, you're just not comfortable. You're afraid that something else may happen if I get in the car. And that was the last thing. That was the last memory you had of you being in the car. And that was traumatic. Post-traumatic stress disorder. Temporary. Or depending on the scale of the incident, that it could be a long-term thing. But it's something that they've witnessed. And that's the first thing we needed to help her to get through, which was to get over. Initially, she had someone else drive her to the clinic to see us. And we came with the idea of, let's help you figure out how to get behind the wheel so you can drive here, so that you can get over that fear of driving again. And the first thing that we had her do was, let's have you sit in the car. Let's just have you sit in the car so that you can kind of wrap your head around of being in the car again at the driver's seat. Because it's very different if you're in the passenger seat. So we had her do that for a little bit. One day or two, depending on her level of comfort. And then I asked her to drive around the block. Just drive locally around the block and see how that feels. Take a route that you know and just comfortably drive around. So you can get in the sort of, we call it leaning into that fear. You already know the routes. You know what to expect. You know the people that will come through. You know where the lights are. You know where the pedestrians are and where the cars are coming. So she did that a couple times and she felt comfortable. And then the next step was to kind of get on a highway to see how that would feel. So over the course of a couple of weeks, she got over the fear of driving again. But she was going at a breakneck speed, not with her driving, but with the things that she was responsible for as a mother and a wife. And we had to ask her to slow down because she was speeding through some of her stuff and that she wasn't getting the benefits of that because she knew she has 3 kids to take care of, maybe sometimes 4. And the fact that her husband was on disability and couldn't lift, she became the man and the woman in the relationship having to lift. And on top of the fact that she's injured and she is going through rehab after a car accident. So she's got a lot going on in terms of life outside of this clinic, that when she is in the clinic, the one thing we could control when you're in the clinic is to slow you down just a tad bit. So you can get through these things, the exercises, properly, doing them right, getting the reps in. So you're not trying to fly through those. So it took her a while to kind of be comfortable with the idea of, she was going at 90 miles an hour outside of the clinic where she was asked to go down to 60, 70. That's a lot of difference. We had to tell her that she needed to slow down so that she can speed up later and use this time as she's slowing down to listen to her body, to be more attuned with her body. so that she can make those changes and get the benefits of working out here and doing it right the first time around. And then once you kind of do it right, then you can speed up. So that's a very important concept that we kind of have to kind of get her to do. Also have another lady. Her name's Grace. Lovely, lovely lady. She's a painter. She's always on the go. She was just coming in to see me for vertigo, and we saw her for about 3 or 5 visits, and she was being discharged. For her, I don't have a fear that she'll keep moving. My biggest thing for her is to slow her down because she's going at 90 miles an hour, and that's who she is. So my job isn't to stop her from that, but my job is to kind of slow her down and use that window so that when she's driving, that it's not a quick, jerky movement, because that will bring on that vertigo. When she's operating a vehicle, that's a dangerous move. So just educating her about those things, that when she's looking over the mirror, to slow down a little bit. If she's going down to pick something up, to slow down a little bit. And that when she gets up in the morning, to not just go from this position, lying down, to sitting up in a flash, but to roll over to her side and then get up. So we kind of talk about those 3 things to kind of help slow her down so then she can speed up with the rest of the stuff that she needs to do. I get it. I get it. She's got a busy life. She's got things to do. You've got things to do. But do realize that when you slow down, to speed up later, it's going to help you with your recovery in the long run.